Hello, everyone, and welcome to our webinar, Applying the C-L Psychiatry Fellowships in 2025, a virtual Q&A, presented by the Academy for Consultation-Liaison Psychiatry and American Psychiatric Association. This webinar is being recorded and will be posted online for later viewing. Welcome, everyone. My name is Chandan Kandai. I'm at UT Southwestern in Dallas, Texas, and I'm so excited to see you all today. So just as a brief overview of the webinar, we're going to start with just like about 20 minutes at most of talking briefly about why C-L Psychiatry, the application timeline and process, and just some match data to put you all at ease. Then I'm going to introduce our esteemed C-L Fellowship Director Q&A panel, and we're going to spend the vast majority of the time just doing Q&A with y'all, the attendees. We're going to be doing a mix of pre-sent questions that you all sent during registration, as well as questions you put into the Q&A as webinar. So this is going to be a lot of fun. So just going straight into it, why C-L Psychiatry? Really, it's because there's just so many facets of C-L Psychiatry that we don't even get to see a lot during medical school and residency. We're all familiar with the inpatient consults model from general psychiatry training, but there's also emergency psychiatry, women's mental health and perinatal psychiatry, psycho-oncology, transplant, cardiac, neuropsych, addictions, pain, burns, trauma, psychiatry focus on patients living with HIV/AIDS, C-L on the pediatric side, proactive models, integrated and collaborative care models on the outpatient side, palliative care, and even geriatric psychiatry that's embraced by C-L. We're so cool because we get to intersect with every different aspect of the medical field. So there's going to be a niche for you. Importantly, C-L Psychiatry is also at the forefront of diversity, equity, and inclusion, or DEI, within the medical field, because we know that patients with psychiatric substance use disorders are underserved in the general medical system, and minoritized and underserved populations are underserved in our mental health system. So C-L Psych can really serve an important role in redressing these disparities. We are an embedded role within the larger healthcare system, so we get to be within the bigger system and see the bigger picture. We're also an entry point for a lot of vulnerable patients into the mental health treatment who we may not traditionally be seeing in the outpatient or inpatient settings. It's also a great opportunity to provide advocacy and education of our physician peers and healthcare staff. So why C-L Psychiatry Fellowship, though? Well, it's required for the ABP and C-L Psychiatry boards, for one thing. It's an additional year to transition from being a trainee to an attending. You get a lot of subspecialized training that you may not get an opportunity to get earlier in your career, like women's mental health, psycho-oncology, transplant psychiatry. And you also get exposed to just whole new models of care, like embedded clinics, collaborative care models, e-consults, proactive consultation. So this is really a year to grow both as a person and within the field. So some special testimony from a former C-L Fellowship Director, Dr. Samuel Greenstein, who's now Residency Program Director at Lenox Hill Hospital out east. So upon graduating residency, he became a C-L attending just directly at University of Cincinnati. He was teaching residents, medical students without any formal fellowship training, and did that for several years. But then he wanted to go back east. His family wanted to. So he wanted to continue to pursue becoming a training director, which was one of his life goals, while working within C-L. But all the New York academic programs, and you'll find this around the country, want people to be fellowship trained, even despite having 3 years of C-L and educational experience in C-L, because they need so many members of faculty, especially say academic, who are fellowship trained. So we actually decided to go backwards and actually wrote an article about an MD Edge about that mental shift between being an attending and then going back to doing C-L fellowship again. So here's the link in case you all want to see it. And again, this talk's can be recorded, so you can go back to it anytime. But a quote I really want to leave y'all with is, the decision to pursue fellowship is a personal choice. I believe that C-L as a subspecialty will demonstrate its importance to both the psychiatric and medical fields. C-L fellowships can continue to innovate and move forward by recognizing the changing landscape of C-L psychiatry and matching the fellowship experience to those needs. This will only make the draw for fellowship more powerful. 4 years ago, I did not want to pursue fellowship. Today, I'm truly grateful I did. So moving now into the timeline itself. So big picture perspective, June, July, so really this month and next month, you want to consider contacting programs, inquiring about C-L fellowship, seeing if what their process is, how they'd like things to do, and also just to kind of get your name out there. July through September, you're going to be completing and sending out your fellowship applications, and it's a rolling cycle. So the sooner you get it in, the more likely your chances are of getting an interview. From September to November, the field holds fellowship interviews, and then December 17th, whether you decide to participate in ERAS or do institutional applications, which we'll get into a little bit, everyone uses a match. So your rank lists are due December 17th for both applicants and programs. And then you find out on January 7th of next year if you match. So where to decide where to apply? Because there's dozens of fellowships out there. So we'll talk about more in Q&A, but general things you want to keep in mind is geographic location. Is this a part of the country that you want to live in for at least a year, if not longer? Think about reputation, like of the fellowship, but also the residency and the department and medical center as a whole. Think about the number of fellows per year. Do you want to be the one CL fellow and have the most attention on you? Do you want to be one of several fellows to have colleagues, but then also have to share responsibilities with? Think about consult volume, workflow, and team composition of doing CL itself, both on the inpatient and outpatient side. And also on the inpatient and outpatient side, think about the clinical experiences you'll be doing. In addition to that, you want to be thinking about didactics and extra clinical opportunities, like will you get to serve on committees, get additional training, say within ethics or geriatrics and so on. Think about will you get academic time to work on projects and write? Will you get reimbursement for educational costs? Will there be opportunities for research and teaching? Speaking of time, what are the policies for time off at your institution? How much time do you give you vacation, illness, parental leave, conferences, especially as being to jumpstart your career within CL? What are the well-being resources for trainees at your institution? What is the culture around DEI at your institution? Are there specific faculty and supervisors that you really want to work with at that fellowship? And do they work with CL fellows? And last but not least, opportunities for moonlighting, both just to make money because life is not getting any cheaper, and also just to begin practicing to be a full attending. When we talk about contacting programs, really this month and next month is just a good opportunity just to contact programs that you're interested in and just have a brief and professional email indicating your interest and just asking for additional info and application materials, like do they take ERAS or institutional application or both? Do they want everything as separate files, so one big attachment for materials? Do they want to include your visa if you're an IMG or not? Do they participate in geographic or program signaling or not? So here's an example email. Dear Dr. Shah, hello, hope this finds you well. I'm applying for CL Fellowship this summer and wanted to email you with my strong interest in Brigham's Fellowship. I also wanted to ask you, please send me any formal application materials and requirements as directed on the website. Looking forward to applying to fellowship. Have a nice weekend. Sincerely, me from circa 2017. And things worked out. So remember, this year, as in the past couple of years, there's going to be two ways to apply to CL fellowships. You can do either the ERAS application or the institutional application. So speaking of the institutional application, so this is basically just something you email directly to programs. They'll have either application form from standardized by ACLP or their own institutional form, and it may include any or all of the following, like a common fellowship application or their institution's application forms, ask for your personal statement, your CV, 3 letters of recommendation, including one from your residency program director, licensure forms, your medical degree, medical school dean's letter sometimes ask for it, USMLE or COMLEX score report some ask, and then if you're an international applicant, your ECFMG certificate and visa paperwork if it's applicable. Just note also for our Canadian colleagues listening in that Canadian residents who have passed license exam requirements in Canada are eligible for USCL fellowships. Now, a lot of applicants decide to go with ERAS because it's something they know from residency and they're familiar with the system. And we've been using this since the 2023-2024 season. So again, just a brief review of that process. You're going to need to obtain an ERAS token from your institution, really beginning early this month, and register your ERAS token to gain access to My ERAS. Again, it doesn't just automatically happen, even if you used it for residency applications. You can begin submitting applications to CL fellowships July 2nd, and fellowships can begin reviewing applications by July 16th. And you can upload pretty much all application materials centrally into ERAS, including your headshot, experiences, personal statement, letters of recommendation, USMLE or COMLEX scores, ECFMG status, and your CV. Just note that brand new for this year, CLs opt into geographic and institutional signals. So, but it'll be up to each individual program whether they accept a signal or not. So you sent in your applications. This year, APRA continues to recommend virtual interviews, but again, it's going to be up to each individual program whether you do virtual or in person. Think about, especially if you're in training or in a job currently, like, do you need a day off for an interview? Is it considered an academic day or an interview day from your program, or do you need to take vacation days to do so? Interview invites go out like in August, October, so you want to reply promptly. I remember in my year, like a program would email me like early in the morning, and then I'd wait a day or so on it, and then when I reply back, oh, hey, sorry, it's already been taken. So be sure to reply promptly to interview invites. September and November, you're going to be doing your interviews. General tips of the interview process, and again, we can talk more about this Q&A. You want to ensure a quiet place with good Wi-Fi and lighting for virtual interviews. You want to create a list of questions you may want to ask during the interview. Want to keep a copy of your application for each program and know what you said. I remember applying once and I'd written like a biopsychosocial like session for like the South Asian American population. And then somebody asked me about it and I didn't remember that I'd done that. So I asked them, what was that? And they're like, it's your application. And things got awkward really quickly and I didn't match with that program. So learn from my mistakes. You want to have PDFs of receiving publications available if you needed to send to interviewers, because now being on the interviewer side, sometimes all we get is just one big PDF of all your stuff, but we may not get individual pieces. So be like, hey, what's your email? I can just send it to you directly. And always be polite, be a good person, thank the program post-interview, especially like staff that are working really hard and really keeping this whole ship afloat. So in terms of ranking and match process, so regardless if you sent ERAS or institutional applications, all fellowships are going to be using the NRMP match process. So remember, you also have to separately register or re-register for the NRMP match. So October 15th, the match opens. November 5th, rank lists will open. So after interviews, be sure to send your NRMP number to programs so they know how to rank you by your NRMP number. December 17th of this year is a rank order list deadline for both applicants and programs. And then January 7th is match day. So post-match, first of all, congratulations. You matched into the bestest subspecialty in all the land. Now you have to be thinking about what is start date of fellowship orientation versus the finish date of residency. And if you're supposed to be working till June 30th, but orientation starts June 24th, there's some math you got to start doing. You especially have to think about, do you need permanent licenses for your state you're moving to, especially going to another state? Is having a DEA mandatory? And just note that certain states like New York, California, Texas are just bears to get their state medical license. You're going to want to start as soon as possible once you find out where you match. Especially if you're going to be relocating, you want to be thinking about housing, like buying versus renting, like neighborhoods you want to live in. Want to be thinking about, do you need to bring your car versus want to use public transit? Whatever benefits you're going to be switching into, like healthcare, vacation, disability. You have to think about ahead of time, like finding you a doctor, dentist, therapist, bank, childcare, house of worship, etc. Is there a moving allowance, and how does that work? Is it a lump sum they send to you, or is it just something you ask for reimbursement afterwards? So there's going to be a lot you may not even be thinking about until you get to that point. So always feel free to reach out to current fellows and faculty for advice. I matched at University of Washington, Seattle for my C-L fellowship. And one of the first things I did was reach out to one of my friends who was a fellow year ahead of me and be like, hey, Jay, like, what should I know? Where should I move? Like, how does moonlighting work and stuff? And it was so helpful to make my move seamless. Just to put y'all at ease for the applicant match. So this is the data for C-L match since we started, like in 2014. And some big picture things to keep in mind, like there are more fellowship spots than applicants, and most applicants get your first or second choice. Just in case numbers are anything, I made lines for this year. And so you can see the top line is the number of fellowship positions keep growing each year. The number of applicants keep growing each year too, but still below the number of fellowships. So this is really a buyer's market from an applicant perspective. And fairly consistently, like across the past decade or so, CL applicants usually get the first or second choice. So please, like, rest easy. Hope we can breathe a little bit now. I didn't when I was applying, so it feels ironic for me to tell you to do so, but please do breathe. So just also some demographic data. We were comparing the demographics from 2014 when CL first started doing the match to 2024. And you can see that we're having slowly increasing diversity within CL fellowship applicants, especially in regards to gender balance and in regards to representation of some minoritized population. But there's still a lot more work needed, especially really to match just a proportion of minoritized folk in the US population as a whole. So some additional resources for applicants. APA has a whole council on consultation liaison psychiatry, and you have a homepage just discussing the field, providing information and resources for people interested in CL. The ACLP also has a whole website in and of itself, and there's a whole residents and fellows section of the website that has a guide on becoming a CL fellow, a directory of fellowships, and then a link for the common CL fellowship application if we choose to go that route. There's a whole ACLP trainee mentorship program that includes residents, and the application for that are due September 30th. We strongly recommend you apply because then you get paired up with a mentor within ACLP who can really help you go through the process of just career development. We also provide trainee travel awards for our annual meeting, which is in November in San Antonio this year, and also for the Web Fellowship, which is a great opportunity to get more involved in CL and show your interest in the field. And these are both due soon on July 1st. So if you haven't already, start taking a look at that. Early career psychiatrists within ACLP also have a whole SIG or special interest group and listserv that is often used to talk about the application process, growing your career as a whole. And then last but not least, Facebook, still a thing, has a whole CL Psychiatry Educational Network Facebook group that has interesting cases, asks questions about the application process, finding jobs, etc. Strongly recommend you all join if you haven't had a chance already. So without further ado, we're going to go ahead to the meat of the webinar, which is the Q&A section. So first, let me please introduce our awesome, amazing panel. So going geographically, first, special thanks to Dr. Adrian Taylor, who's CL Psychiatry Fellowship Director at Brigham and Women's Hospital. Thanks very much for joining us, Dr. Taylor. Next, we have Dr. Sarah Nash, CL Fellowship Director at Columbia in New York City. Thank you again so much for joining us, Dr. Nash. We have Dr. Morgan Fader, CL Fellowship Director at the University of Pittsburgh. Thanks so much for joining us, Dr. Fader. We have Dr. David Kasich, the CL Psychiatry Fellowship Director at Ohio State University, or some say the Ohio State University. Thanks so much for joining us, Dr. Kasich. We have Dr. Raymond Young, CL Psychiatry Fellowship Director at Emory in Atlanta. Thank you again so much for joining us, Dr. Young. And last but certainly not least, we have Dr. Tom Soprano, the CL Psychiatry Fellowship Director at University of Washington. Again, so lovely to have you again, Dr. Soprano. And then there's me. Hi, I'm Chandan, and I'm an attending at UT Southwestern in Dallas, Texas. I got this headshot, like, I think my PGY3 year of residency from APA, and I am never, ever letting it go. So now I'm going to stop sharing my slide for a sec, and we're going to do Q&A. So I'm going to stop sharing. If you all have questions, please feel free to put it in the Q&A section. But I am first going to start with one of the pre-sent questions that a lot of you sent in ahead of time. So panelists, I wanted to ask, why do fellowship? Like, why not just go straight into, like, practice?
I'll jump in. I think a fellowship is a wonderful opportunity to get specialized training under a lot of supervision, and it's a great opportunity to meet people within the field. And I think, as Chandan said before, if you're interested in being in an academic center, working in an academic center, I know that at our institution, we really only hire people who are CL trained. and boarded. So I think that's important if it's something that you're thinking about as a long-term career goal. It's worth the year. It's 1 year of reduced salary, but to put it bluntly, people who go into C-L psychiatry are not going into it for the money. So I think that you can, you can take the year. Many programs actually pay reasonably well, and I think that it's just a great chance to see the whole depth and breadth of the field and to really learn from experts and figure out if you want to be a generalist, to find a niche, what makes the most sense to you.
Yeah, I guess I'd just like to echo what Sarah said, but then also like what Shandon had mentioned previously in the presentation. I think it's just like a really great opportunity to maximize all of your options. So like whether or not that is your clinical options and making sure that you're seeing a lot of different types of cases, a good volume of cases, and then as Sarah said, like the breadth of opportunities and exposure within CL psychiatry, but then as Shandon mentioned, and the uh, the uh, the written experience from one of the faculty within CL. It's just it really allows you access to a lot of different opportunities from a job perspective, research perspective, and so I think it really just like allows for additional flexibility in your career.
Yeah, agreed with both Dr. Taylor and Dr. Nash. And I would just add, you'll feel really well prepared to be an attending after doing fellowship. I think the biggest thing I get from PGY4s in terms of being concerned about going forward and getting their first job is just not feeling terribly well prepared to be an attending, as opposed to they're really good at being a resident. By the time you're done with fellowship, you'll be, ready. You'll be feeling like you're past ready, but you really will be ready. And when you start your attending job, you'll have a level of confidence that people coming straight out of residency just don't have.
I'll add to that, I think a lot of fellowships really focus on both education and leadership skills that I think residency doesn't have as much time to develop in people, as well as professional identity. And then in terms of jobs, this is something that has certainly changed over the last decade. When I graduated many years ago, it used to be that pretty much anybody could find a CL job, regardless of CL training. I don't think that that's going to be the case in the coming years. Already, it's very tight at probably most of our institutions for the people who are here. I know that because we're part of this WWAMI region, you can get a CL job in Montana and Wyoming. But I think even those places are starting to dwindle in terms of CL jobs unless you have a fellowship. So.
The versatility in our field, I think, also is pretty unmatched, and the return on investment for 1 year in fellowship for all the different leadership systems, teaching, networking opportunities that you'll have. I think it's a field that still feels like a smaller family and a chance to really build your network during that year of people who will become lifelong and career-long mentors. I think CL docs end up sometimes doing all different types of things over their career, but the chance to really begin to deliberately plan the rest of your career, or at least just plan for the things that could happen that you don't even know about yet, I think are some of the best things about the fellowship experience.
Yeah, I guess I'll speak last. I think a lot of people, as they complete their residency, are maybe fairly good clinicians, but there is some missing training to be a good, really good CL psychiatrist. And that fellowship training does give you the breadth to be able to handle a lot of complexity. And just to re-echo what everyone was saying in terms of leadership skills that you learn, and then the job opportunities. If you're very interested in academic medicine, if you want to become a fellowship director one day, you have to do a fellowship. You're not going to be able to do this without it. So I don't want to rehash everything.
Awesome. Thank you all so much. This is something that's on a lot of people's minds, so I'm glad we can discuss it right away. Moving on to another very, very popular question that were sent by registrants. As CL Fellowship Directors, what are y'all looking for in applicants? Like, is there a specific amount of things you want, specific letters, specific number of publications, like just like OMG, like what do y'all want from us?
I can go ahead and start this time. I think for me and for our program, we're not looking for specific numbers. We're not looking for a bunch of papers or necessarily research experience. I think all those things are wonderful to have. I think what we're looking for are people who have significant interest in passion about doing consult liaison work, whether that's in an inpatient setting, an outpatient setting, integrative setting, something about what is it about CL that stirs them. And I really look at the personal statements. I like to read those statements, and you really get to learn what drives a person to want to go into this field. And that's what we're looking for. Some people fall on to the idea of CL late in their residency, and they're just learning about it then. And I think that's wonderful if you're learning about it at that point versus someone at the very beginning. So it really doesn't matter for us. So I don't think people should be afraid to apply regardless of what experience you have. Go ahead and apply. And, if you show that you have passion, you have interest, we're going to interview you. And then there's going to be a question of where you fit with each program. As what was spoken about earlier in this seminar, it's a buyer's market. There are more positions available nationwide than there are people who actually apply. So people should apply. I mean, of course, we're not going to interview somebody that we don't think has the skills and doesn't have the resume. But I think people need to be open-minded and relaxed about that.
Yeah.
If there's an oh, go ahead.
Sorry. Yeah, I totally agree. I think that everybody here needs to not worry too much about what's on their application and more be thinking about identifying what their goals are in the process of fellowship. I want a fellow who is a good fit for our program, and it, frankly, is kind of impossible for me to judge that. I kind of depend on trainees to kind of figure out what will be best for them. And I try to display what my program looks like and what we can do. And if there's a good fit and there's kind of like some hopefully mutual feelings about that throughout the interview process, I think that's most important. So I think in the Q&As, there was also this question about how to best prepare. I think it's the same thing. So I think the best applicant is one who has taken some time to reflect on what they're trying to get out of this year. And frankly, the way to prepare is just start that process now, and we'll pick up wherever you leave off and kind of support that. So I think the best way to prepare is understanding yourself and provide as much transparency as you can in the process of the application process.
Yeah, I was just
Remember
going to
what's on
say,
there. Oh, sorry, you were.
oh, sorry. No, your application should reflect you. You want it to really assume you're one of us and you're reading a gazillion applications, right? You want yours to stick out, and the way it'll stick out is if it best reflects who you are. And I think within CL, if you have specific things that are of interest, you're not held to them by any means. But I think if you can explain specifically why CL, that's helpful beyond I have an interest in medicine and psychiatry. Because obviously you have an interest in medicine and psychiatry, which is great. We all do. But if there was a specific experience or a specific way of thinking about things, that I think can be very helpful to us to show that what you really want is CL. And the personal statement and your letters of recommendation and pretty much everything in your application can point to that. I agree with Dr. Young. I don't have any cutoffs. I don't think many of us do in terms of your scores. What we want to see is that you're going to be able to pass your boards in CL, which if you've been passing the USMLE, well, then it's very nice if you have a high score, but if you have a high score and, the rest of your application is lackluster, I really don't care so much about the high score. And if for some reason you had a situation where you had a bad experience with testing, please explain it. Because, you know, if you had the flu and you had to go in and you had 102 fever, I get it, and your score will be a little bit lower. But I think that that's often evident because one step is considerably below where the other steps are. So I don't think anyone's out to get you. But just you always have an opportunity if there's something in your application or your resume or whatever that requires a little explanation, feel free to explain it. And if you've had other relevant life experiences that may feed into being a C-L psychiatrist, feel free to explain those too, because that's really helpful. We get to know you.
Yeah, I think I would add, and I think echo what other people have said to an extent, is that we're looking for you to go to a program that you want to go to, and we're looking for people who want to be here. And so, you know, if when I describe what our program has to offer, you feel like you're a better fit somewhere else, that's great. We've helped you figure that out. There's absolutely nothing wrong with not wanting to go somewhere because it doesn't fit with what your goals are. I think everywhere they really want people who want to be there and want to take in everything that they have to offer. And so, yeah, please be yourself, because that is going to get you the best place for you, whether you know where that is when you start applying or not. So.
Awesome. Thanks. Go ahead.
Thanks. Just gonna offer a word of encouragement also to anybody who's interested that is in a newer residency program or a program that didn't have a lot of CL exposure experience. I think, like Dr. Young mentioned, sometimes people come to this interest later in residency, and sometimes they're also interested and motivated, but they just haven't been able to connect yet with either mentors or a lot of exposure to more complex consult patients or in a larger academic medical center. So we would encourage people with all different types of experience to apply if they have the interest in developing their skills.
And I'd just like to add people from DO programs to that as well. Some of our most fantastic fellows have been from DO residencies. So, yeah.
Thank you so much, Dr. Fair, because that's actually a question that some of our DO attendees had. Like, is there any like this distinction between like MD versus DO applicants? And I'm just seeing a bunch of shaking of heads from all the program directors. So that's just a no. So put that to bed. Moving on though. Since the last year's fellowship panel, we've had a change in management in the United States. And so things are a lot different now. And certainly the climate feels very different, especially for immigrants, visiting students, IMGs. So I just wanted us to talk again about if you're an IMG applicant, like from Canada, but also further away, how does that impact your application to CL? How do you figure out if a program accepts IMG applicants or not? And do IMGs, you know, generally make it within CL fellowship?
I can tell you that we had a fellow this year from Canada, and the fellow was able to come and train with a J1 visa and have a experience like all of our other residents that were US grads. I think one place that applicants could look would be on the ACLP webpage and the directory of fellowship programs. They usually list the different types of visas that they would accept when applying.
Yeah, so I'll just add, and I saw a question in the Q&A about like Harvard affiliated programs, so I'll answer that question as well. But I think it's, you know, I think it's a fluid situation. So I think that there's information that's kind of coming in every day. But I think generally my experience is that IMG applicants do well throughout the recruitment process, but also in a fellowship, in their fellowship years as well. I know that within our program, in the last 5 or 6 years that I've been at Brigham, we have had an IMG, our visa holding fellow in our fellowship class, and so I think like other programs, we've remained open to reviewing applications and very excited about interviewing IMG applicants and having them train with us. To answer more specifically about the Harvard affiliated programs and some of the kind of negotiating that's happening with the Trump administration in Harvard. Most of the Harvard affiliated programs are actually doing their visa processing kind of internally, and they are not necessarily attached to Harvard University itself. So for instance, at Brigham and Women's Hospital, and so this goes for Mass General Brigham as well, we have a centralized international office that is shared between Brigham and Mass General. And so all of our visas are associated with that office and are not processed through Harvard. I think like one of the things that we don't know is how the administration will view Harvard specific visas versus Harvard affiliated visas, but as of now, it hasn't yet impacted any of our trainees. And so hopefully that provides some reassurance. I think given the fluidity of the situation though, I think always just asking questions of the program is going to be like really helpful, and getting a sense of how they are processing these issues and questions as we learn more.
I'd like to just add, Adrian, that's so valuable, and I think it's very similar at Columbia. I would encourage people to always apply. The situation is moving, so don't not apply because you think, oh my goodness, this particular program or this other place may have a problem. And from our perspective, we're going to interview the people who we want to interview and who we think would be a great fit for us. And then we'll sort of figure out the details later. I agree that you want to check to see what visas programs, support. I know for us that hasn't changed, but we support J1. We don't support H1. And that's just been a longstanding thing. And the other thing I would say is, as for anyone applying for fellowship, but probably all the more so if you're coming from another country or if your family is based in another country, to make sure that you apply to places near where you have support. And I think that may be especially true if there are limitations on people being able to go back and forth to countries of origin, that having some support, whether it's family or friends, will be helpful. And I know that the programs, the government may do certain things and universities may do certain things, but within the programs, I think we're all very committed to taking care of our fellows, to being supportive of our fellows, to training our fellows, and really creating wonderful doctors, wonderful C-L psychiatrists. So the program will, I think all of these programs, all the C-L programs in the country will provide a lot of support for you. But if you do have that extra layer of family or other social support, make sure you apply in places where you can have a little bit of that to depend on as well.
So actually, Dr. Nash, that brings up another question we've answered in years past, which is if you're at a program that already has a C-L fellowship there, like, can y'all walk us through like the decision, do you stay at your home institution to do C-L fellowship? What are the politics of not applying there, but wanting to go elsewhere? Because that can be sort of awkward territory to navigate, especially if you're interested in C-L as a field.
I don't know if you were asking specifically for me
No,
to
no,
start,
no.
but
Just to
I'm
clarify,
happy
this
to
is for
jump in.
all of you. Like,
No, I think it's a great question, and it's something that has come up for us in the past. And I think there's often a misconception that internal candidates are absolute. That's going to be one of your fellows, and I think that that's not something any applicant should think about. I think that internal candidates obviously are known better by the faculty. Sometimes it's a good thing, sometimes it's not, right? So you have to sort of see where you are. But also, as a program, we really want, like Dr. Fader said, we want people to end up at the program that's going to be best for them. And sometimes, and this has certainly happened to us, there are internal candidates who really want to, expand their horizons beyond where they've done their residency. And we support that. It's helpful if people tell us. They don't always tell us, but if you feel like that is something you can do, that's great. You can tell us if you really think you're part of our program and you're not going to rank us very highly, or you don't have to. Nobody ever has to. And I think that it's important for people who have C-L fellowships within their programs to explore other programs as well. even if you're like very determined to stay at your home program and you've gotten a sense that they want you, because this is a great opportunity to meet people in the field, just like going to the ACLP meetings. And it's a wonderful opportunity to sit and have interviews with your people who are going to be your colleagues moving forward. And you know what? At the end of fellowship, you're going to be, or middle of fellowship, you're going to be looking for jobs. And if you've met someone on the interview trail, I think that's a very nice opportunity to get reconnected. And just as a something to throw out, our program, we keep everybody's information, everybody who's applied, including people we've interviewed, people we haven't interviewed. And when we have job openings, one of the first place we go to is our list of fellowship applicants. And we think about people who we ranked highly on our list, people who we liked, who may have done fellowship elsewhere. And often we will reach out directly to those people saying, hey, we have this open position. If you're interested in interviewing, let us know. So I think that it's of great value to interview, broadly at places that you're interested in. I think if you've no interest, I wouldn't waste your time or the faculty's time. But if you have some interest, go ahead and do it.
Yeah, I'll second that. The CL world is incredibly small. I always encourage my fellows to go to ACLP 3 years in a row, and then you'll know everybody there. It's, I think it really depends on each applicant. Staying put can be really helpful. It often segues into a really sweet job if you want to stay there long term. You have an opportunity to get a little bit more depth within your own institution. If you go to a new place, obviously new experiences, wider breadth. And then oftentimes you don't even know what you might be missing at another place. And that can be very rich as well. You frankly can't go wrong, honestly. I've never met somebody who's done a CL fellowship and has regretted it. I think it's go and apply widely, get a good gut feel of them all, and go with your gut.
Yeah, just to reiterate what everyone is saying, we all as fellowship directors are also faculty as part of our respective residency departments as well. So we're not just fellowship directors, we're also part of the residency institution. And so we're mentors for our residents who work with us, who rotate with us. And so, we support our residents in whatever field they want to go to. Of course, if they're excited about C-L Psychiatry, we're happy about that and we're excited about that too. But we're not necessarily focused on them coming to our institution. If they like staying at him, I think that's great. If they want to expand their areas, we're happy to do that too. We always encourage them to get involved in the ACLP because I think that's a very good place to start to learn more about CL. So I think we're all very supportive. We're teachers and mentors first before fellowship directors.
Yeah, I'm in the position of being APD for our general residency for the PGY 3s and 4s. So I help introduce them to people at places where they want to do fellowship. And so sometimes we get people who want to do fellowship, but want to go somewhere else. They want to go home, or they want to go where their spouse is from, or they're just sick of it here. And I'm always happy to introduce them around. So I don't think you should, if you don't want to stay at your home institution, you can still ask for letters of reference and you can ask for introductions. And sometimes those are the most powerful of introductions. Like, hey, I hope to train this person and I think they'd be great. We keep them, but they want to go somewhere else. So.
Awesome. Thank you so much. Again, attendings, great questions coming in. We'll get to all of them soon. Panel, one question that came up both in the Q&A right now and also pre-sent is, how can we best prepare for applying into CL? So when we first started this webinar, I really thought it would just be like only people about to apply to CL fellowship, but we have a lot of PGY 1s, PGY 2s, people becoming PGY 3s. So if y'all could answer, like, for people early on in training, how can they best prepare for eventual application for CL? And then for PGY 3s, anything they should be doing, like, as they get ready to apply for fellowship?
I think one of the best experiences residents could have to help them make a little more of an informed decision about fellowship or where they may apply would be to try, if they can at some point, either in medical school or residency, to go to one of the ACLP meetings, which is every year in November. Another opportunity would be to participate in some of the mentorship opportunities the Academy sponsors, the trainee and early career psychiatrist mentorship group, or even we have a medical student mentorship group right now. And I think just the more people that you meet and the more that you hear what people are interested in and what they do, I think it could help you a lot sort of early on begin to focus your interests academically. And I think, as others have mentioned, people also just think about fellowship because of opportunities to live somewhere else or maybe personal circumstances. It's just a year, but again, sort of the gateway to so many more things beyond.
I would agree with that. I would also say do a lot of things that aren't CL in residency. So take your elective time, maybe do an outpatient clinic, an outpatient sort of integrated care clinic, because that people don't necessarily know what outpatient CL looks like. But also do all the things that you think you're not going to get during fellowship so that you still have that that experience. One of the best things that I did in my PGY 4-year was a developmental disorders clinic. And I'm so grateful that I did, because now when I see patients with developmental disorders who are in the medical hospital, I have a better frame of reference than I would have had. And that's not a clinic that I could have done as a fellow. So that might be available some places, but it wasn't where I am. And so, yeah, I would say get a lot of experience that's not CL, as well as enough experience in CL to know that you want to do it, but also everything else that you're not going to get a chance to do that you can do during residency.
I think most residency programs have some type of scholarly project activity that residents need to complete. And so if you're relatively early on in residency and you're thinking about CL and you have a CL program, whether it's a fellowship program or there's always CL in the hospital where you are, you can feel comfortable reaching out to the CL attendings. And maybe somebody is doing something that you can jump onto as a project, or you have an idea and it can be integrated into some other things that are going on. We've had a number of students, some of whom have gone into CL, residents, some of whom have gone into CL, some of whom have gone into other things, who've done really interesting projects. Sometimes it's sparked by a particular case they might see on a PGY2 rotation, or sometimes it's something else. And that can be helpful if you're trying to decide between CL and something else. And I think that as Chandan mentioned at the beginning, CL is very large in terms of the things it can include. It's a very, very big tent. So I would say if you're thinking about, gee, I really like treating substance use disorders, or I really like women's reproductive health, or I'm really interested in something, that's all under the umbrella of CL as well. So you can go out and take a rotation in any of those things. And if you find that you really enjoy that and you still have this interest that's a little bit broader, consider a fellowship here. I mean, all of those things add in and add value.
I would say just follow your curiosity. Do what you actually are passionate and care about. And don't do things just to get a line on the CV. I don't think those matter. And ultimately, there's like so many of those things, they just get lost in the shuffle anyways. I think when people are really passionate about what they're doing and they really care about it, it shines through. It doesn't have to click any particular box. So, authenticity to yourself is what I'd say.
Thanks, all. Kind of transitioning more into the letters of recommendation. So who should we be asking for letters? We know one has to be from your program director, but who else should we ask it for? Do they have to be from CL people? Like, what if CL was a while ago, or you just didn't have a great experience on CL during residency training? And is it okay to have more than 3, or just some of the questions people kind of have had in this vein?
I'll go ahead and start. I think for us, I think we want letters from people who we believe know you clinically, know you as a resident, and get a sense of what you might be passionate about, but really getting to know you clinically. So outside of the residency director, I don't, at least for me, I don't necessarily need somebody to write a letter that's from CL. I mean, I think it's great that they do that and people do, but if it's someone else that knows you that is relevant to their academic institution in some other way that knows you, I think that's important. I mean, more letters is great, but not necessary as well. What was the other part of the question?
Oh, no worries. I asked multiple questions in the one
Oh,
question.
okay. Yeah.
So can you have more than 3 letters?
Yeah, I mean, I think that's fine too. You don't need to as well. So I think it's just important, at least for me, when I look at this, we want letters, but good letters that seem to know you and connect with you, not something that's more generic from that standpoint. But I'm not necessarily looking for somebody who's getting something specifically from CL, although that's great, but not necessarily.
Like I mentioned before, it's a small world. I would say that if you know any of your faculty who knows faculty at the place you're applying to, that's going to probably be your best bet, honestly. Like, if I get a letter from Chanda and I'm like, I know this guy, I know what he means when he says best versus like, so I think that is pretty meaningful. And chances are, like I said, it's a small world. Most people know each other. So I just ask around in your own institution to say like, hey, do you know anybody who's, been to UW, or, who nobody knows somebody who knows somebody who's been there. And chances are there's somebody, and if not, it's okay. Like, we take letters at face value. It's not everything in your application, but I'm kind of a fan of getting at least one letter from a CL provider. If you didn't have a good experience in your training, one, I'd be curious as to, like, you should maybe write in your personal statement why that is, or because that would be curious to me, like, oh, you're interested in going to CL after a really bad experience. Like, I mean, that is kind of impressive, and I want to hear more about it. So I think you can kind of explain that. So.
Yeah, I agree. I mean, I don't necessarily need to see a CL letter, but I'm going to be wondering why there isn't one there if there's not, and so explain it. Yeah, definitely people in the field. If you can get if there is a fellowship director, if you have a fellowship where you're applying from, if you can get it from the CL fellowship director, that would be great. If assuming that they know you. But I think most important, yeah, is people who really do know you clinically and can give more than a generic, I read your CV and here are some great things on it kind of letter.
I think the other thing that I would add is just maybe also just thinking broadly about like what encompasses CL. I think a lot of times we think about like, my letter has to come from somebody who I rotated with on the inpatient CL service, but I think like as we've all talked about, like CL kind of like covers a lot of different areas. And so we also at Brigham look for a CL letter, and I think it's helpful if the CL letter is not there, that it's explained somewhere in your application. But I think that we also just I think we're aware that CL services are built up or made up differently at different hospitals, and that CL like encompasses a lot of different areas. And so think about like any people that you may have rotated through who like through subspecialty clinics or stuff like that during PGY 3 year, who you've also developed good relationships with and can write you a positive letter.
Yeah, and just a couple of words on letter writing. I mean, when you ask someone to write a letter for you, if they have a less than enthusiastic response to your request, maybe this isn't the best person to write the letter for you. And that it's not, I am not impressed necessarily that the chairman of a department wrote. Usually the chairman's letters say nothing because the chairman probably doesn't know you. I would rather see something from a junior faculty member who really knows you, who can really give some specifics. I also think that if it's been a couple of years since you did a CL rotation and you're reaching out to your CL attending from that rotation, whether or not that person is still at your institution, because it's totally fine to get a letter from someone who's left your institution and is somewhere else, it may be helpful to remind them of some of the specific things that you did. Because if the rotation was valuable and it made you think, gee, I want to go into CL, I'm sure that you remember one or two patients who's and the experience with that case and what that did for you. And if you can remind the letter writer about it, maybe write a paragraph, or if you're still at the institution and the person's still at the institution, even say, hey, this was the person I took care of. Here's the medical record number. If you want to go back and review what we did, because it's been a long time ago, don't expect that the attending who has seen 1,000 patients since then is going to remember who this patient is. But probably with the little bit of background when they talk to you about it, it will remind them. And then that's like really nice because you can get a letter that says, hey, this resident worked with this patient with an eating disorder and did X, Y, and Z therapeutically and in terms of medications and spent a lot of time and engaged the family. And to me, that's a much deeper letter than a more generic thing. So I think those would be sort of things to think about. And it is often helpful to letter writers, not just to provide them with your CV, but to provide them with a couple of specifics. And then also, I think it's very helpful when I'm writing a letter for someone if they show me their personal statement, because that also gives me a sense of why they're going into the field. It helps me direct my letter a little bit better. So I think those are some tips that might be helpful.
Thank you all. So actually, Dr. Nash and the whole panel really, like speaking of personal statements, right? Like, what are y'all looking for? Because I mean, the personal statement has really more from like applying to college to being like, hey, who you are, write this as a sonnet, maybe do like an Elwood's applying to Harvard Law sort of thing, to like medical school, to residency, now fellowship. So for the personal statement for like CL fellowship, like what are y'all looking for from potential applicants?
I can start this one. What I don't want to see is just a restatement of your CV, but in like a paragraph format. Anything else is totally acceptable, and hopefully something that's hopefully goes beyond what your CV is and giving us a sense of like who you are as a person and what drives you.
I want to see why somebody is doing it. Are you passionate about just seeing more cases and you just want to see as many cases as you can and not think about all the other things attendings have to think about for another year? That's great. Are you somebody who has ambitions to be a program director or, be in academics? That's great. I mean, whatever it is, I want to know why you're doing it because everybody's doing it for a reason. They're giving up, a year of attending salary. It's not a lot of time, but it's something. And I'd like to know why.
Yeah, I think authenticity, telling a story about how you came to your interest. A lot of the most compelling personal statements will talk about like a specific sort of patient or case or situation where the resident really sort of discovered their passion for this work. I think those all are more important in my mind than what you've accomplished. Having a sense of or like giving an indication of maybe what some of your future goals might be, if there are certain populations within the CL world that you're interested in, I think that's a good place to talk about it there. Sometimes even if you talk about the types of work environments that you like, I'm always curious what an applicant would be like as a member of a team. A lot of us work in teams, either in inpatient or outpatient settings. If they have a particular sort of philosophy or values around leadership or around teaching, I think those are good things to talk about. But more than anything, it's really just another chance for us to get to know who you are and really, I think ultimately what fuels you.
Awesome, panel. Thank you so much. So,
Can I add one other thing?
Okay.
I think that sort of echoing what everybody said, it's important that your voice come through in the personal statement. And so it should not be an AI generated statement. I mean, I think that's something that is newer and we are sort of getting into the experience of dealing with. it should also be a proofread statement, and ideally one that someone who you know can read through as well. I would rather hear your voice as your voice, even if English is not your first language, but it's authentically your voice. That's much more important to me than it being some AI generated, perfectly flowing thing. But I also think you want to be thoughtful about not having typos and not have, I mean, these are, you'd think people would, but these are definitely things that I've seen, because one of the things that's important is you're going to be doing a lot of writing. You're going to be writing notes and you're going to be writing other things. And I think letting the program kind of see your style is helpful. And it brings out you more. So.
Thank you all. One more question about the application process before I transition more into interviews. So a lot of people have been asking, like, hey, is it important I send out my applications on like the day ERAS opens? Because again, remember the last time people used ERAS was residency, where all the programs are saying like you have to send out the day like ERAS opens, or like you will get pregnant and die, like Mean Girl style. So like for CL fellowship, like, do you need to send out the minute like ERAS opens, or is there like a little bit of flexibility? Like when is a good time to send in your application for CL fellowship?
I would just say practically, it's important to look at program deadlines because they're not all the same. So what you really don't want to do is miss the deadline. And we take that pretty seriously because we have people who have made the deadline. And every year there's inevitably one or two people who come in a day or two after the deadline. And that generally doesn't reflect well. If you've never been exposed to CL and you suddenly had a new rotation and you're like, oh my goodness, I'm just doing this rotation, I just thought of this, and someone can vouch for you, okay, that's one thing. But if otherwise it just looks like you don't have your act together, which doesn't bode well. I don't think you need to have everything in the minute it opens, and please don't send things before the program gates open. If you're using the non-ERAS forms, it's just, again, follow the directions. I think that's an important thing to do. But I would say soon, demonstrate your interest. It doesn't have to be on July 1 or July 15 or whatever day ERAS opens, but because interviews start being considered as we're moving into August, as we're sort of thinking about things and reviewing applications, you don't want to be left out because you were, kind of sitting on your application. I think it's okay. I would say for us, if it's in by the third week of August, it's probably in a batch I'm going to look at altogether. If it comes in after the third week of August, it's going to be in a separate later batch that I look at.
Yeah, I totally agree with Sarah. This is like a statistical thing. Like you want to be in early if you want to get into more competitive programs because it's rolling admissions. I'll admit a batch like to fill some positions, but I only will interview so many people before, all the positions are full. And then if you're too late, that sucks. And sometimes I'm like, I want to interview people that come in really late, but then I also don't want to tax my faculty with doing another full set of interviews because it takes a lot from the program as well. So I would say just getting it as early as you can, but don't stress about it. Just, yeah, sooner is better.
Yeah, agreed. I mean, ideally, we try to be done with interviewing by the time we start interviewing for general residency, because most of us also do interviews for the general residency program. And so, yeah, pay attention to our deadlines because really we're kind of done by middle of October, end of October in terms of interviewing. And if we fill those slots, then I don't know how many more we're going to make, if any. So, yeah.
Once in a while, there are applicants that often it's usually personal circumstances or relationships. They're just uncertain about the ability to apply immediately, or even sometimes for a variety of reasons, they become interested in a fellowship, but it's after the match deadline has passed. So if you do have an interest, there's a particular program that you're really interested in, and either you're kind of behind with your application or the programs will sometimes still be able to work with you, or some programs can sign fellows after the match, although that window I think can vary depending on the program. So it's never a bad idea. And I think, Chanjan, like you had mentioned at the beginning, if you have some specific interest in a program and maybe something got off track, I would still reach out to the program director with an email and maybe inquire about the possibility of still connecting with them.
No, thank you all. So interviews themselves, like, big question everybody had is this year, are programs going to stay virtual, or are you all going to move en masse back to in-person interviews? What's the hot guess?
I haven't heard anybody that's going back to in-person. All virtual here.
Yeah, we're planning on staying virtual.
Same for us. I think that probably across ACLP, most of the programs will continue to do virtual interviews. Some programs may decide to do in-person or hybrid based on their situation, but I think that most programs will do virtual. So again, I think that it's just kind of like helpful that if you are sending that like pre-interest email, these are like some of the questions you might be able to ask just to get like more details about that specific program and what they're doing in their recruitment season.
We're also going to be virtual this year, and I have to say, I think going virtual was one of the best things that ever happened, because we started getting applicants from all over the country in ways that we hadn't before, and we've matched people from all over the country, and it's just been a really wonderful thing for our program. And some of these folks are people who want to relocate to New York, and others have been people who've said, I'm from wherever it may be. Somehow we've gotten a lot of people from Texas, but we've had people who have their lives in Texas, and they said, we want to come for a year, and then we're going to go back. And that's been fantastic. And I think it just enriches everything. So if you're interested in a place, don't hesitate, reach out, apply, and enjoy the opportunity to meet people.
Follow-up question for the panel as a whole, like what happens on the interview day, like for a C-L fellowship, like especially compared to like residency interviews or like med school interviews? Like, how does it go? Is it a full day? Is it scary? Who do you have to meet with? Is it scary?
It's not scary at all. I mean, like every interview, it's nerve-wracking when you're talking to people you don't know, but it's usually a pretty short day. I hear some programs, like I know that Stanford has people do like presentations and various things. I think other programs have various things. At UW, you go through 4 interviews with myself, 3 of our faculty, and then also you meet all the fellows, because those are the people that you are proposing becoming. And I really encourage all applicants to really talk with the fellows at the program. They're going to have the best inside scoop on things and give you a real sense of how things are. I think that's super important.
Yeah, ours is similar. Meet with one of the fellows. You don't meet with both of them, but you meet with one of them, and then it's 4 faculty members plus me, and the only thing that I do is basically give you an overview of the program, which takes forever anyway for some reason. I try to get to know people a little bit, but I'm probably the least important person in terms of feedback into the process. In terms of ranking for the interview, I'm here to try to sell you on the program, and then my faculty will be asking you various questions. But the way we do it, and we went to this a few years ago, was we tried to standardize not necessarily the questions that people are getting asked, but the areas in which people are getting asked questions, so that what we're trying to do is find people who are essentially like people who have done well in the program in the past. And so it's not just like a popularity contest. It's, we try to take into account that people are introverts, and a lot of people aren't like some, faculty, or are like faculty or whatever, and try to take that out of it. So yeah, we're hoping you'll relax and be yourself, and give some thought to the questions that we're asking, because we're asking them to try to find people who will do well with us, and hopefully will enjoy their time here as well.
Yeah, I think for us, it's similar to a lot of the programs around the country. You know, we have the applicants meet with our faculty, either 4 or 5 of our faculty who can participate, and then meet with our fellows, since that's the most important person. And we want the people who to apply to try to relax, because the goal is for us to let them know about the program, to get to know the program, but we also want to get to know them really well. So how they come across in an interview is very important. How genuine they are. We recognize that people come in different personalities, whether they're introvert or extroverted. But we want people to come across genuine. Can they talk about things that were important that they brought up in their personal statement? Can they talk about things meaningful that they might have stressed in their CV, like a C-L research project? Can they talk about it? Can they talk about it in a passionate way? Those are the things we want to see. The other thing we want to emphasize, that even though our interviews are virtual, I mean, you do have to present yourself in a professional way and be mindful of your body language. You know, if you're looking at your watch or clock, or you can tell you're looking at the screen and doing something else, or you're distracted. Those are things that people will look at as potentially unprofessional. So you just want to be mindful of those things as well.
We have a similar process, I think, as others have mentioned. It's about a half day on Zoom, and I think I meet with the applicants first at the beginning, and kind of like Dr. Fader said, just to really give them an overview of the program and to try to help the applicants imagine what it would be like to be here. I think that's the only grief I have about virtual interviews, is that it's just hard to sometimes get a sense of the place if you're not there. So trying to describe even just like what an average day is like, what their schedule would be like. Applicants really have a lot of questions, I think, as they start to go on more than a few interviews, you know, sort of how do the different programs compare, what makes a program unique. So that starts off the really the half day, and then like the other programs, the faculty are meeting for about 25 or 30 minutes with each applicant. And really it's about a mutual fit. We're really just trying to get to know who you are and imagine, you know, sort of you as a future teammate.
Yeah, I think I would just echo kind of like everything everybody said. Our interview day is structured in a similar way, where you'll be able to meet with myself, our assistant program director, and a few other faculty, as well as meet with a couple of our fellows. But it's really just an opportunity for us to get to know you, like outside of your application. And I think, like others have said, just kind of like thinking about, you know, what are the reasons why you're applying to C-L Fellowship? What are your interests? And you know, allowing that to come through during your interview day, thinking about how you're presenting yourself, not only with the faculty and the program directors, but also with the fellows. And then you might also interact with some of our support staff during the interview day, whether that be education coordinators and things like that. So just kind of like thinking about your your professional self throughout the day, because you know, a big thing that we think about within C-L is just how we interact with others. A big part of our job is working in teams, but also kind of like working across the hospital. And so just making sure on the interview day you're presenting your best self, and allowing the passion that you have for the field to show through.
Cool. Thank you all. I guess getting more into specifics, any specific tips you'd have for like potential interviews you're seeing, maybe based on like some like either great or hilariously bad things interviewees have done for you in the past. I will say personally, my favorite was when an applicant made a really good case for why they wanted to go to my program, but it was in fact not my program, but another program in Texas. So at the very least, know who you're interviewing with and where they go. But I'll just leave that.
I keep in mind, Chandan, I don't think there are really any bad questions during the interview, and probably especially early in the process, applicants they're still learning a lot about the field. And I think the interviews are a great chance to keep building your network and just meet people, and to spend a little bit of time with them. You never know when your paths are going to cross again. Often it's sooner than later. Um, so yeah, I think sometimes we have some genuine moments or authentic moments. It's all okay.
I would caution people about asking too early on, especially about work-life balance. Um, if you want to ask about sort of wellness initiatives and that kind of thing, I think that's actually quite different. But the work-life balance question is a little bit of a red flag these days. So I would yeah, there are a lot of other ways to get that information. So I probably wouldn't use that phrase.
I also think it's important to know that within any given program, all the people interviewing you are going to talk to each other. So you want to be consistently professional and consistently presenting your best self. I have had situations where I've interviewed someone and it seems like it's been fantastic. And then I talked to one of the faculty members who said, I mean, one year it was, when you talk about things, I mean, there was someone who sort of made openly misogynistic comments to one of our faculty members. And it was, that went from off our list, not ranking, nothing like, I mean, it sort of didn't matter. Someone was fantastic on paper. That was the end. And I would never have gotten that from my interview because I think people were on their best behavior with the program director, but you got to be on your good behavior with everybody. And so that's something to think about. And then I think be your authentic self. I think that's what we're talking about. There are no expected answers. Sometimes my favorite part of an interview is we'll ask a question with the intention of seeing how people think on their feet. And there's no particular answer we're looking for. We're just interested in having a good conversation. So if there's some kind of thoughtful answer that comes up, that's fine. And then sometimes someone, as the interview will progress, will say, I'm thinking a little bit more about that thing you asked about. And here's another thought I have. And that's great when that happens. I mean, it's an opportunity to think about things and not to worry, not to think that there's a particular answer that's being sought, but just again, as an opportunity to get to know who you are. And if you're being your authentic self, that will come through.
I've just got to add also that the fastest way off of our list is to be rude to our program coordinator. And I think that's going to be true in a lot of places. I also see somebody asking more about why mentioning work-life balance during interviews is a red flag. It's not so much that wanting to know what your life is going to be like is a problem. It's that putting that to the top of list of questions to be asking during an interview makes it look like the work part of work-life balance is not as important to you as we would like to see for fellows. I mean, fellowship is a lot of work. It's not easy. And I don't think anybody expects it to be. And I don't even think that people who are asking that question expect it to be. I think that people don't understand that to the faculty, it can come across as, I want to see, how much time, how little time I'm going to have to spend at work. How's that? Which just doesn't make us have a lot of confidence that an applicant is going to want to put in the time and see the cases that they honestly need to see to become expert by the end of fellowship.
To that point, one of the things that comes up frequently when we're discussing candidates is, how do you think this person would manage the Friday 3 p.m. or 4 p.m. consult? Right. And that's something that we discuss in our ranking sessions, because if we get the feeling that someone's going to really sort of push back too much, nobody wants to do a 4 p.m. We're not dumb, we sort of know that we don't want to be there either at 4 o'clock on Friday afternoon. But if someone has given a vibe that they really, aren't going to want to be there to do that case, if a case comes in and we need them to do it, that's not great. So I think that is probably also what you're getting at, Dr. Fader, and that's something that comes across not necessarily in a very direct way. If it does, that's really a problem, but you want to be careful that you don't indirectly indicate, how little can I do? I think that in in our programs, and I imagine this goes across the boards, but I can say it's true in our program for sure, our faculty work very, very hard, and we want to work very, very hard, and we want to work very, very hard with our fellows. So I think we want people who are also interested in sort of rolling up their sleeves and working hard. We're not asking anyone to do anything that we're not willing to do ourselves. And so I think that's also another reason why it can land the wrong way if it comes across, again, not in a genuine way. If you have a reason that you want to say something like, hey, I'm getting married in, 2 months after I graduate from fellowship, and I'm going to be living in another state, and there are going to be weeks when I'm going to need to go away for the weekend. How can we work that out? And is there a way I can come in earlier? I can do that. That has a very different feel to it than, hey, what time do we finish Friday?
Yeah, I think, to Dr. Fader and Dr. Nash's point, it's very realistic and frankly very mature to be thinking about what it's going to be like to live in this new place, if it's a new place or even an old place. And asking questions about that is totally fair and something that I would expect every applicant to ask to some degree, like, if you have a family, like where do people, go to school and what is transportation like? All these things are super reasonable questions. I think that more specifically get at some of the questions that like, work-life balance are really asking about, but in a specific way that you can apply to your life. I want applicants to be imagining themselves in this place, Seattle in my situation where they what is it like to live like there, and having a really good conversation about that is a great way to spend some of your interview time because, we want people to come and stay, frankly. And I think most programs do. Um, we're fine with people go and take jobs elsewhere, of course. But, we're in it for the long haul. So, we want it to be realistic.
All right. Thanks, panel. So second to last question. People have applied, they've gone for interviews, they put on their rank list. On the fellowship side, like when y'all are making decisions about how to rank people, like is there a specific part of the application you're focused on more, like letters of recommendation, like scores, like personal statement, or like how do y'all decide like who you want to rank higher for match at your fellowship? Like what's the secret?
Um, I'll answer for us at Emory. I don't know if there's really any real secret at all when it comes to this. We want the applicants to be, of course, good on paper. What they bring to it, what their CV is, what their passion comes across in a personal statement. How did they come across in the interview with our faculty and our fellows, and do they feel like they would work well with our program? And then ultimately, we do look at applicants who do they seem like they are passionate about us as well, because part of that fit is, do they really want to come to our institution, or there's some other motivation? And those things kind of, we put all that together and then we talk about it and then we come up with our list based on those things. But I don't have a formula. I think our program doesn't have a formula. I can't speak to the other institutions though, but I do think it's about how the applicant comes across. Are they good? Do they have good letters? Are they passionate? Do they have a good interview with us? Do they get along well with us? Do they seem motivated and feel comfortable with our institution? Do we think that they would do well at our institution? But that's important too. Or would they be overwhelmed? We are a large academic center in Atlanta, and that's not always a good fit for everybody who applies to us. So we take all those things into account, and then we come up with our list.
Yeah, I would just echo what Dr. Young said. I don't think that there's any like secret formula or secret sauce that goes into us like picking our rank list. I think it's kind of like taking each applicant as a whole, like thinking about their application itself and then what our experience was like during the interview day. We also are kind of like looking at like fit or just like general interests. What are the things that the applicant's thinking about or wants to bring or is thinking about bringing into the field of CL, and does that fit with what we might have within our fellowship program? We're a fellowship program that has 2 tracks, and so we kind of have a general track and we have a psycho-oncology track. So we're often kind of thinking about what people's general interests are in CL, but then if they have specific interest in psycho-oncology, would that person be like a good fit for that particular track? And so I think it's just really like looking at each applicant and deciding what that applicant's experience would be like if they were to join us in our fellowship.
Just wanted to add also that sometimes the way we know someone is very interested in the program is because of the way the interview has gone or something they have written. Sometimes we know someone is really interested in us because they tell us. There's no requirement to say anything to a program. I'm going to rank you in such and such a way, and we cannot ask you, and we will never ever ask you how you think of ranking us. What I would say is, do not tell a program you are ranking them number 1 and then don't rank them number 1. Because if you don't end up matching in a program that knows you wrote something and they know how they ranked you and they didn't match with you, that's a very awkward situation. So I would say if you absolutely know something is the way it is, you can say something, but if you're not sure, you can express strong interest, but I wouldn't specify, because that becomes a professionalism issue. And the 1 or 2 times that that's happened to us, our general sense has been, wow, we dodged a bullet. Because if this is how this person is going to maneuver, we're happy that that's not going to be something we're going to have to deal with all year long. But overall, we've had a lot of people who say we're really interested. Some people call us back. They say, can we talk more with the fellow? Can we, I have questions about things. There are some people who we do things virtually. If people want to visit, we do that after we've submitted our list. So our list will be submitted, but if you really want to come and see what things are like, that's fine, and we're not going to change our list. I would definitely express your enthusiasm if you have it. And as long as you're not saying, I'm ranking you number 1 or I'm ranking you to match, then I think it's fine to be a little bit vague, but definitely demonstrate that you're passionate about it. I also think that if you're coming from a part of the signaling may help with this, but sometimes when we have applicants from all over the place, we don't know that they're interested in moving to New York if they don't tell us we really want to be in New York. So if you have a reason that you're applying, for example, at Columbia, and you're coming from somewhere else in the country and you're really, really interested, tell us you're really, really interested. And we're not going to ask personal questions, but you can say things like, hey, my partner works remotely, so I can be anywhere. Or, I'm looking to do this for at least a year and I'm not opposed to staying. I don't know exactly what I want to do, but for the fellowship year, I really want to be in New York. And I tell people on the first day when we interview, if you don't like New York, you're not going to be happy. And I think that's what Dr. Young was saying too. You have to know yourself that if you don't want to be in a sort of big, gritty, urban medical center in New York City, we are not your program. But if you're interested in that, we have so much to offer you and we would love to have you.
Sort of same. I feel like we'd like to see that there's some connection to Pittsburgh, and I'm not sure if in Columbus you have similar, because we're not New York and we're not Boston and we're not Atlanta, we're not Seattle, and it can be hard to sell a city that gets talked about sometimes positively, but a lot of times not terribly positively. So we're looking that somebody knows something about Pittsburgh, or at least is willing to keep their mind open to being in this part of the country, which is, pretty honestly different from just about anywhere else. So, yeah.
All right. Well, again, we've come to time. I do want to ask panel if you could stand for just a little bit longer. I wanted to give all of y'all opportunity just to make a case for attendees, again, because more spots than applicants, like all of your fantastic programs. I just want to give you a minute or so to just say like why applicants should consider your program. So again, we'll just go geographically. So Dr. Taylor, why should applicants consider Brigham and Women's?
Yeah, I mean, I think like many of us have said, I think we're looking for people who are passionate about the field of CL psychiatry and thinking about how they can progress themselves forward in CL, but also the field of CL itself. Looking for people who are interested in innovation and leadership. As I mentioned, we are a program that has 2 tracks. So we're looking for people who may have specific interest in CL, but also may not. But if you do have particular interests, we have different liaison relationships that we've developed with other services across the hospital. And so we're looking for people who might have interest in those, and then particularly who are interested in getting subspecialty interest within psycho-oncology. We are also a program that gets applications from people kind of across the country as well as internationally, and so just looking to develop a diverse class and looking to have people join us who have a lot of different pre-lived experiences.
Oh, cool. No, thank you so much, Dr. Taylor. Dr. Nash, why should potential applicants consider Columbia?
So Columbia's been in the news a lot over the past months and year, not in a good way, but I want to be very reassuring that our clinical enterprise is going 100% and that there is no expectation of any changes in that role, even though there has been a lot of many hiccups in terms of our research work. And I do think that a lot of that is being thought about very carefully and hopefully will be restored. We have just a fantastic program. We have a lot of fun. Everybody who comes enjoys being at work. We have a wonderful breadth and depth of our program in terms of the different parts of C-L Psychiatry. And our program is one that's always innovating, always interested in changing, related to feedback. How can we tweak? How can we make it better? We have fantastic faculty, and we just really have a very good time. And I think a lot of people stay, and that's probably the best testament to our program that I can give, is that people come, they like it, they stay. And one of the things that I personally love about the New York Presbyterian Hospital, where we're based, is that we are simultaneously a quaternary care destination medical center, and we're the community hospital for the local Dominican population. And so you get everything. And it's really just, it's really an incredible privilege to take care of patients there. And I think that that's what our whole faculty feels. We have a wonderful residency program. Our fellows get to work with fantastic residents. They work with fantastic medical students. Everybody gets to learn a lot. And we have a lot of food. So come and, there's constantly somebody is baking a cake. Somebody is bringing in cookies. There's always something. There are bagels, and New York has, bar none, the best bagels in the country. So if you really like that kind of stuff, I think you would be very happy with us.
Thank you so much. Dr. Young, why should applicants consider Emory?
Well, yeah, thank you once again for leading this seminar. I will say that, Emory, like all the other institutions here, we're very passionate about our work, about taking care of patients. Our Department of Psychiatry itself is a wonderful program, and our CL program is a strong representative of that program. We've been part of the institution for the last 17 years, and all of our faculty who are involved in CL are passionate about that work, passionate about bringing in new young residents to become fellows, to eventually become faculty. And we love the work. I think things that are unique about our program is that we do work at 3 major sites. We do have our main academic Emory University Hospital Center. We also have our big tertiary center, Grady Hospital, and then we also have the Atlanta VA. We have a number of outpatient programs that involve subspecialty programs like transplant, psycho-oncology, and integrative care medicine. So we do a lot of different things. We also work closely with our geriatric fellowship, our addiction fellowship, and our interventional psychiatry, because we like to work together on some things that we have common ground. So we have some didactics that we do together. We have some fellowship case conferences that we do together. And we do a how to teach seminar, because one of the things we do focus on is learning to become better teachers. And we do that also as a group. And I think Atlanta is a great city down south. I'm originally from California, but I love Atlanta. I love the people here. Like New York, we have wonderful food here. We have tons of sports organizations, whether it's the Atlanta United or the Falcons or Braves, the Hawks. I just went to an ultimate Frisbee game this past weekend. We have a ultimate Frisbee league. So, lots of things to do here. It's a great place to be.
Thank you so much, Dr. Young. Dr. Fader, why should applicants consider Pittsburgh?
Any number of reasons. One being, I'm going to give a plug for the city first. Pittsburgh is a great place to live. It's an easy place to live, and it's a nice place to live, and there's plenty to do here. I like to tell people, well, it's not New York, but then again, it's not New York. For a city its size, it has an incredible amount to do. Outdoor opportunities are everywhere. There's decent theater, there's a good symphony. The food is actually really quite good. And I really like food. So although I can't say that we have somebody bringing it in all the time. I think I'd be a much bigger person if we did. But so you may have one on us there. But in terms of our program, we are also constantly changing. This year, we are adding on an inpatient psycho-oncology rotation to our usual outpatient psycho-oncology rotation. We have world experts in perinatal mental health and in transplant psychiatry. I don't know what I want to call myself in terms of expert in neuropsychiatry, but I'm there. We have unique models of collaborative care that you'll see in our Huntington's Disease Center of Excellence, which is the only one like it in the country. And we're a quaternary referral center for, I guess, everything east of Columbus and west of Philadelphia through a lot of New York and Maryland and West Virginia as well. So if it happens, you'll see it here. And I'll leave it there.
Thank you so much, Dr. Fader. Dr. Kasich, why should applicants consider The Ohio State University?
Well, I think not unlike Pittsburgh, we're a vibrant Midwest city. Columbus is growing rapidly. It's the largest city in Ohio. The medical center is also growing rapidly, and I think our fellows are people that have a growth mindset and see themselves as future leaders. We have a large psychiatry residency program here. We take 18 residents a year. They all do 5.5 months on C-L. So our fellows really get a chance to lead teams and develop their medical teaching and system skills. We're now the third largest department in the College of Medicine at Ohio State. So there's lots of things happening across the department, and that is something that really helps our fellows pursue niche interests. And we try to make sure that they all have enough elective time. We make sure they all have elective time, but that they have a chance to explore some different areas and think about the year as a chance to really begin to build the foundation for an academic career. All of our graduates have gone on into academic settings, and about half have stayed at Ohio State, and that's part of the growth that we've had as a department. And we cover about 1,400 beds all on one campus here. It's all walkable with 7 different hospitals. It's a tertiary quaternary academic medical center, level 1 trauma center. All the things that a C-L fellow would want to do are here. And we're growing rapidly into the outpatient space and some of the different care models that our field is championing. We have one of the first collaborative care programs in a cancer hospital. And I think more than anything, it's just a very friendly, livable city. It's a great city for young professionals. And I think it's part of why so many residency and fellowship graduates end up staying. We have other fellowship programs in the department and across the medical center that our fellows spend time with, whether it's some journal clubs or M&M experiences that we have with the fellows from different specialties together. It's a great place to learn and to live.
Thank you so much, Dr. Kasich. Last but not least, Dr. Soprano, why Seattle?
Well, Chandan, I think the answer is obviously that we have you. You are one of our graduates. So, that alone demonstrates, just how awesome we train people. Honestly, I think there are just so many good programs. I think we happen to be one of them. I think we're lucky in that aspect as like the home of collaborative care and DBT and a lot of other things. But frankly, I would encourage everybody here to not try to find the best program, but to find one that like really fits you really well. And the best way to do that is just, go to the interviews and really get a good feel for it and try to imagine yourself there and what life would be like. And let us sell you in those moments, because I think that when you look at them all on paper, it's a flurry and it's confusing, and chances are you probably get trained excellently almost anywhere. So you really got to think about what you're looking for, and then go in with that mindset of does it have what I'm looking for, and is that something that they're really good at training? So that's all I have to think. Thank you guys all.
Oh, thank you all so much. I'm just attendees. I know we're a bit over time. Thank you all for being patient. I'm just going to share last couple of slides. So again, remember, these are just resources for prospective applicants. So both through APA and ACLP, there's a lot of great opportunities coming out. So look for more information, especially about the mentorship program coming soon. And be sure, if you're interested, to make the deadlines for the Training Travel Award and the Web Fellowship, because that's coming up in about a week or so. Again, thank you all for joining us. A very special thank you to the APA Council on C-L Psychiatry and ACLP, including the Fellowship Education Subcommittee, Mentorship, and DIA subcommittees. Ken Priggett and Andrew Kimball, ACLP staff. Kent is helping just keep this whole thing afloat through the webinar. Bertram and Aaron Smith for APA staff helping publicize this. Dr. Samuel Greenstein for sharing his personal story. And of course, our amazing panel. This comes up every year. A lot of times, attendees will have very specific questions about their applications and they don't know how to ask it discreetly. Like, feel free to email me. Like, this is my Gmail, chandan.kandai@gmail.com. Please don't sign me up for spam. Like, I appreciate it. But if you have a question you want to ask our panel about your specific situation, feel free to email to me. I can always ask them anonymously and then get it back to you. Again, everybody's got their own stories, their own questions. We want to just help everybody pick the best specialty in all the land. This event is part of the ongoing ACLP mentorship workshop series, so look for more cool things coming for ACLP soon. And this is my now 2-year-old son encouraging you to apply to C-L. Thanks all. We're going to end the recording right now. Have a great rest of the weekend and beginning of the week.